Welcome to all my dears. Today we are going to deal with the morphological peculiarity of Crohn's disease. We had completed the definition, then ethiopathology, then pathophysiology, common sites, mode of presentations, etc. regarding the Crohn's disease. Next to that, now we are discussing about morphological peculiarity. Before that, as you know that if our patient is having ulcerative colitis, usually the inflammation or usually it affects the rectal areas and the infection may spread from the rectum to upper part of the colon proximally, and the spreading is very continuous manner or in a diffuse manner. But in case of Crohn's disease, you can see most of the patient with Crohn's disease having involvement of terminal ileum. That means there are about 50% of patients will have involvement of terminal ileum. And next to the segment of the colon, the area will be devoid of any form of inflammation or any form of infection or any form of pathology. That means a normal area can be seen here. And very next to the normal area, again another segment of colon may be affected. The same is repeated in different parts of the colon. This portion of the colon is affected, and again this area is affected. But usually you can see there is sparing of rectum. That means usually rectum may not be affected by Crohn's disease. So on examination, you can see healthy sections alternate with the inflamed one, and thereby there is multiple separate, demarked, well-marked normal areas are intervening with the abnormal areas of pathology. And in a patient with such characteristic of Crohn's disease is known as skip lesions. It is nothing but segmental or discontinuous inflammation of multiple areas in colon. Next, about the degree of inflammation. It is mucosa, it is submucosa, then it is muscularis, and lastly the serosa. Mucosa, submucosa, muscularis and serosa. In ulcerative colitis, usually the erosion or inflammation or ulceration, etc., usually limits in the mucosal level, or it may spread up to muscularis level. It is the usual presentation in ulcerative colitis. But in case of Crohn's disease, the erosion that will involve the mucosa to submucosa, or it can be from submucosa up to muscularis, and it can up to some serosa. That means the same can travel outside the serosa. So, coagulation of multiple different ulcers in various parts of the colon get coalesces, and the ulcer starts in a long axis manner of our colon, and the same will leads to perforation and penetration, and such ulcers are characteristic of Crohn's disease, and it is known as number one morphological peculiarity of Crohn's disease is serpentine ulcer. Okay. Next, about the third one. On sections of colon, you can see there is some raised area of submucosa in Crohn's disease. The raised area following normal areas of depressed area, and automatically on evaluating a patient of Crohn's disease, you can see there is some raised area alternate with a depressed area. Again, raised area alternate with a depressed area due to the submucosal thickening, due to the granuloma formation. If so, such conditions are known as number 3. It is cobblestone appearance of the colon. It is due to the mucosal thickening. In affected area, the affected areas are depressed and the normal areas are raised. So, alternate hump and dump can be seen, and such condition is known as cobblestone appearance. And next, about number 4. It is the Crohn's have a characteristic of a typical transmural. That means, in case of ulcerative colitis, the inflammation limits in the mucosa and submucosa. But here, the inflammation will run from mucosa up to the serosa, or it can even pierce or penetrate up to the skin, and thereby involving 4 layers of our colon, and such involvement of the total involvement of layers of colon is known as transmural morphology. So, the morphological peculiarity of a patient with Crohn's disease, number 1 is presence of skip areas, that means alternate normal area with the affected area. Number 2, serpentine ulcers. Number 3, cobblestone appearance. And number 4, transmural affection. That means involvement of all layers of the colon. These are the morphological peculiarities of a patient with Crohn's disease, and thank you for watching. Next can be